Smarty, I should say. How did you get into the space of Xplant and BII? And, obviously that's, the foundation of us getting introduced. Where did that come from? What was your evolution? I imagine you did implants before you did Xplants.
Yeah, when I was in med school, I think about a month, and my sister called me and told me she had breast cancer. And of course, I'm now the doctor, even though I'd been in school for like 4 weeks, and just to sort it out. And fortunately, that day the lecture was being given by an oncologist. And afterwards, I asked him, I'm like, hey, my sister called me and said she has breast cancer, and she was in a different city. And he had a colleague there. He said, hey, that's not a problem. I'll call my, colleague and I'll set up an appointment with her. And I flew down and went to that appointment with her. And ultimately, uh, she went through mastectomies, reconstruction, chemotherapy, suffered some cardiac problems from chemotherapy, and lived overall a relatively long period of time. And she recently passed away of a recurrence in the new year.
I'm so sorry.
And I it's one of those things where you talk about trauma a lot, and I had always kind of put that in the back. And people asked me why I went into surgery and why I did so much oncology reconstruction, because that was my career basically. And it was mostly about cancer reconstruction for women with breast cancer.
Mm.
And, I never likened it to that as the sentinel event of why I did all that work and why I was so passionate about that work. But of course, when you think about it, that's a driving force of why I did all that for so many years. So the short answer is I did oncologic reconstruction for head and neck cancer, sarcomas, which are tumors of muscle and fat and soft tissues. And then I did, of course, breast cancer reconstruction, which is unfortunately the most prevalent cancer we take care of in plastic surgery. And to implants, I was never somebody put in a lot of implants. I did a specific type of surgery called microsurgery, and it allowed me to do reconstruction that was with your own tissue. So
Mm.
I was seeing problems with implants from radiation and people getting infections from chemotherapy. And then I would do other procedures, taking the tissue of the abdomen or other areas of the body to reconstruct after removing those implants that it had. Um, Become problematic for the patients, either through those therapies or from scarring, which happens. And there were lots of issues, because everybody should understand that an implant, one, is never a lifetime device, to be clear. And anytime, you're trying to explain that risk benefit ratio to a woman who's going to go through breast cancer treatment, it's pretty complicated.